Hello everybody and welcome to the Thursday edition of Video Clips, and just a couple of announcements. Keep those career inquiries coming. Lots of you are finding out there are some great opportunities helping people to improve their health and using diet and lifestyle change as a primary intervention tool in a healthcare practice. So keep the inquiries coming. I love having discussions with you guys and sharing what we do and how we do it here and how we can help you and all that. Second thing, keep in mind the free membership. You can check out our content and get a feel for what we do here by signing up as a free member, and then decide if you might want to upgrade to one of our paid memberships where you can have access to more cool stuff. And last but not least, in I think it's about a month from now, I'm starting the Food Over Medicine coaching winter session. We're going to have a new group of graduates who can open Food Over Medicine chapters in their areas and affiliate with us. So if you're interested in any of that stuff, pampopper@msn.com is my email address. So I picked a couple of topics that I think are important today, and the first one is laryngopharyngeal reflux, or silent reflux. It's often referred to as silent reflux because people often don't have symptoms. Stomach acid causes reflux, is part of it, but it's really not the primary thing, which I'll explain in just a minute, without heartburn. So it's a different type of condition. Symptoms include, instead of the typical heartburn that you might experience, hoarseness, chronic cough, breathing difficulties, frequent throat clearing, swelling and irritation of the vocal cords, sore throat, feeling as if there's a lump in the throat, difficulty swallowing, chronic and recurrent sinusitis, and bad breath. The condition is often associated with the exacerbation of other conditions, particularly asthma and bronchitis. Risk factors for developing silent reflux include a weakened esophageal sphincter, delayed stomach emptying, hiatal hernia, constipation, smoking, and being overweight. Dietary causes include overeating, diets high in protein and fat, particularly protein, as we'll see in a minute, alcohol, spicy foods, and carbonated beverages. Now, the causes of both gastroesophageal reflux, or GERD, and silent reflux are the same. The pathophysiology of silent reflux is quite different than GERD. In the case of silent reflux, the damage to the laryngeal tissue is due to the action of pepsin, not to the effect of stomach acid. Pepsin is a digestive enzyme produced in the stomach that breaks protein down into polypeptides. While proton pump inhibitors, or PPIs, are frequently prescribed as treatment for silent reflux, the American Gastroenterological Association advises against them for this condition if patients do not have typical symptoms of reflux. In fact, PPIs are really not very good for either people with GERD or silent reflux. The treatment effect is pretty low, and there are serious side effects such as nutritional deficiencies, damage to the microbiome, and increased risk of several degenerative diseases. The best strategy for treating silent reflux is dietary modification. Pepsin, the irritant that I was talking about earlier, remains active up to a fairly high pH, which means that low acid eating can be helpful. And in fact, we have some research that shows that. A study including 20 patients with silent reflux who had not responded to treatment with PPIs showed that within 2 weeks of adopting a low acid diet in which all foods and beverages with pH less than 5 were eliminated, symptoms improved for 19 out of the 20 patients, and 3 patients became completely asymptomatic, and that's within a fairly short period of time. In this study, carbonated beverages, which have a pH of between 2 and 4, were identified as the most common trigger for symptoms. And this is due to the infusion of carbon dioxide, which results in the formation of carbonic acid. So people ask me sometimes, is it okay to have carbonated water or carbonated beverages? And a little bit, yeah, but you don't want to make a steady diet of it for this and many other reasons too. Another study showed that adopting a plant-based Mediterranean-style diet with very low animal food intake, 2 to 3 servings a week, which is in line with the recommendations that we make, high intake of fruit, vegetables, whole grains, and nuts, and drinking slightly alkaline water, pH of 8, and that's slightly alkaline, so don't go off the deep end with some of these alkalizing machines and things of that nature. Well, anyway, doing these things resulted in a significant reduction in symptoms and was more effective than taking PPIs for treating silent reflux. And by the way, almost anything is more effective than PPIs, and I've written other articles on PPIs that are posted in the Health Brace library that you might want to take a look at too. Plant-based diets are less expensive than treatment with PPIs. There are no negative side effects. In other words, when you do the things that we're talking about here, you address the underlying problem, there are all kinds of other benefits too. Your cholesterol goes down, your blood pressure goes down, your weight goes down, the whole 9 yards. So anyway, I've been asked a lot about silent reflux because it is a different condition, and the typical treatments, they're not really good for regular reflux, but they are completely ineffective for silent reflux. Okay, so that we finish the week on an angry note, wait till you hear what I have to say now. The medical system is unfortunately organized in a way that rewards bad behavior and bad practices. And I think there are a lot of good people who go into medicine, and what you end up with is good apples and bad barrels, and you all know what happens. If you put a good apple in a bad barrel, sooner or later that apple gets spoiled too. And unfortunately, I think that's what's happened here. So one of the most egregious examples of just a bad system, bad practice is what we call the chemo concession. It allows oncologists to purchase drugs at wholesale and bill insurance companies and government plans for the retail cost of the drugs. Selling drugs to patients accounts for about 65% of the average oncologist practice income, and one research group says that this dwarfs the amount of income that they receive from evaluating and advising cancer patients. They're actually making more money on the treatments than they are taking care of the patients and giving them advice. Well, for years, critics have said that the practice is not a good one. It rewards doctors for prescribing more drugs and offering more profitable treatments, and a new review confirms just this. Dr. Aaron Mitchell, MD, of Memorial Sloan Kettering Cancer Center in New York, is the lead author of a meta-analysis of 18 studies that looked at this issue, and it's highly disturbing what these researchers came up with. He says, quote, "Based on the research that has been done to date, it looks like the profitability or the financial reward for treatment influences which treatments cancer patients receive." So Mitchell and his team report that 15 of the studies show that doctors make decisions based on financial incentives. 5 studies on radiation therapy showed that doctors who profited from offering it themselves were more likely to prescribe it. 3 studies of prostate cancer treatment showed that urologists who provided radiation therapy in the office were more likely to recommend it, and 2 studies showed that these doctors were more likely to recommend intensity modulated radiation, which is reimbursed at an even higher rate. Several of the studies showed that doctors often chose more expensive drugs over less expensive ones, more profitable treatments over less profitable ones, and delivered treatment for longer periods of time based on reimbursement. Oncologists were more likely to make decisions about breast-conserving treatment or mastectomy based on reimbursement rates, preferring, for example, mastectomy if the reimbursement rate was higher for that procedure versus a breast-conserving procedure. The studies showed that as the profitability of certain drugs goes down, there's a corresponding decrease in the use of those drugs in oncology practices. And so, for example, what the researchers pointed out is that consistently when a cheaper generic version of the drug becomes available, the doctor just stops prescribing that drug and goes to another that doesn't have a cheap generic to keep the price high. Even the setting in which procedures are performed seems to depend on reimbursement rates. For example, when the reimbursement rate for in-office cytoscopic procedures was increased, doctors started doing more of these procedures in the office rather than in hospitals or surgical centers where the reimbursement rate stayed exactly the same. Now, this information is disturbing but not surprising. I mean, even good people can be corrupted by bad practices and systems, as I mentioned earlier. I think it's very unsettling to think that a doctor would make a choice that's not in the best interest of the patient in exchange for financial gain, but it appears that that does happen. Now, I think that there are a lot of ethical oncologists out there who find this situation as appalling as I do. I know some very good oncologists, and we've had many members here who consulted with oncologists who really had the patient's best interest at heart, spend time with them. So this is not an indictment of the oncology profession in general. It's an indictment of the system that takes good people and turns them into bad actors. You know, that's what I'm talking about here. At the very least, disclosure of the financial arrangement to patients should be required, but it's not. And that's part of the problem. If doctors had, first of all, I think the practice would end if doctors had to say, look, Mrs. Jones, you have breast cancer, and I'm going to do this surgery, and I make more money on this surgery than another type of surgery. Or I want you to do this treatment, and I'm going to show you right here. Your insurance company is going to pay $100,000 for the treatment, and I make $45,000 of that. I think if they had to show that, they would stop this nonsense. So transparency would be a very welcome thing here. But in the meantime, cancer patients should really carefully consider any recommendation made by an oncologist before acting on it, check it out, get research, look at outcomes data, and carefully consider. The other thing is that, I hate to say it, but I think sometimes the open hostility to the idea of using diet and other adjuvant treatments as part of the plan is brought about from a couple of things. Number one, doctors don't get a lot of training about that kind of thing in school. And the second thing is when you start talking about going someplace else other than the doctor's office for treatment, sometimes instead of the treatment the doctor's offering, that's revenue walking out the door. And again, I want to be very, very clear here. There are great doctors out there. You just have to really make sure that you're talking to one of them, and I would still check everything out. Medical centers often advertise that they offer patient-centered treatments. That's kind of become the buzz phrase when you see it in ads and on television and that sort of thing. It's supposed to make you want to go to that particular place, but it seems that many oncology practices and centers are anything but patient-centered. So buyer needs to beware. So anyway, somebody asked me, this has been posted on my YouTube channel a couple times, in between all the recommendations for plastic surgery and some of the other great ideas you guys come up with out there, some of you. Somebody said, why are you always so negative? And I don't mean to be so negative, but there's a lot of negativity to talk about. And I'll tell you what's worse than listening to negative stuff is not knowing the negative stuff and becoming victimized by this kind of thing. You know, it's better to know about it. And that's what I get excited about here. I like when people really demonstrate that they're completely empowered, that they're not just doing what people say, that their health and lives are not at risk by just following directions that may turn out to be not such a great idea. So anyway, make your decisions carefully. Become an educated consumer. Remember what I was talking about on Tuesday. Take my research and writing class so you can learn to be even more discerning. All right, that's all for today and all for the week. Hit the subscribe button. We're going for 25,000. Then we do another drawing. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.